Hi everyone. In today's clip, I will talk a little bit about erectile dysfunction, or ED for short. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, erectile dysfunction, known for short as I mentioned as ED or impotence, is a common male sexual issue characterized by persistent or recurring inability to achieve or maintain penile erection firm enough for satisfactory sexual activity. It usually affects men between the ages of 40 to 70, but it can happen at any age really. Occasional difficulties can happen basically due to tiredness, but persistent issues would obviously need medical attention. The causes of ED are quite diverse and can be physical, psychological, or a combination of both. Your feelings play a major role in getting and maintaining an erection. Feeling relaxed and confident for arousal is essential, obviously. But it's normal to sometimes have erection issues. Erection problems can happen if you feel nervous, anxious, frustrated, or even tired. Drinking alcohol or using substances can also have an impact. It can also result from other conditions or as a side effect of certain medication or treatment that you might be on. In many cases, ED can be the first symptom of another underlying problem, including heart disease. ED is divided into several categories. We have vascular erectile dysfunction, which includes causes that impact blood vessels that send blood to the tissues that allow you to get and maintain an erection, or the valves in the penis that normally hold blood inside. This is the most common type of ED, of course. Then we have neurogenic erectile dysfunction, which is a result of nerve problems which prevent signals from traveling from the brain to the penis to create an erection. This can happen because of trauma, pelvic surgery, conditions like stroke, radiation therapy, neurologic conditions, spinal stenosis, or even multiple sclerosis. Then we have hormonal erectile dysfunction, referring to an ED that happens as a result of testosterone deficiency, or in some cases as a result of thyroid issues. Then we have psychogenic erectile dysfunction, and this involves psychological conditions that affect your thoughts, feelings, or behavior. Erectile dysfunction affects over 50% of those that are between 40 and 70, as I mentioned. And those numbers may be actually higher because many don't speak or they don't seek for help because due to embarrassment or shame. Now, these symptoms include only sometimes being able to get an erection before sexual intercourse, or being able to get an erection before sexual intercourse but not being able to maintain it during the act, or complete inability to get an erection, or requiring a lot of stimulation to maintain an erection. There are many possible causes of ED, as I mentioned, including conditions that affect the circulatory system, nervous system, or endocrine system. The health factors causing the issue can include diabetes or diabetes-related neuropathy, high blood pressure, high cholesterol, vascular disease, chronic kidney conditions or disease, atherosclerosis, low testosterone, stroke, epilepsy, injuries or trauma to the penis and surrounding area, penile fracture, injuries to pelvis bones, hip bones, sacrum and tailbone, bladder, prostate, and spinal cord issues, pelvic surgery, including prostate, colon, or bladder cancer surgery, radiation therapy. Erectile dysfunction is a common side effect of many prescription drugs as well. Common medications that list ED as a potential side effect include antidepressants, anti-anxiety medications, blood pressure medications, diuretics, antihistamines, chemotherapy drugs, Parkinson's disease drugs, prostate cancer medications, sedatives, muscle relaxants, anti-seizure medications, substances that have addiction potential, including like alcohol, amphetamines, barbiturates, cocaine, marijuana, methadone, nicotine, opioids, and so on. So the substances can affect and suppress the central nervous system, and they can always cause severe damage to the blood vessels, which may lead to permanent erectile dysfunction. Then, of course, there are psychological and or emotional conditions like depression, anxiety, stress, fear of sexual intercourse or intimacy, or low self-esteem. A healthcare provider usually reviews your medical history and and will ask some personal questions to perform a physical exam to diagnose ED and determine the cause. As awkward as this might be, it is needed for them to get to the root cause. And it's important to be honest in your answers and responses in order to quickly determine the cause. And they may even ask to speak with your sexual partner for additional insight. Depending on what your doctor suspects, they may order blood tests, complete blood count, lipid panel, liver function tests, kidney function tests, thyroid test, testosterone test, urinalysis or urine test, penile Doppler ultrasound, tests that measure if the nerves in your penis respond to vibrations, drugs and that sort of temporarily make the penis erect, magnetic resonance angiogram or MRA. So remember that sexual intercourse isn't the only way to increase intimacy between partners. You can show your partner you care through physical contact, such as like holding hands or back, or doing a back rub, spending time with them, kissing, writing notes, being patient with each other, and being a good listener. So on the orthomolecular side of treatments, it's important to appreciate that an ED diagnosis likely indicates greater significance than just a loss of ability to have satisfactory sex. In fact, ED is considered to be one of the earliest representations prognostic of atherosclerotic cardiovascular disease, hyperlipidemia, hypercholesterolemia, tobacco abuse, diabetes, or coronary artery disease, as I mentioned before, are also common risk factors. So fortunately, pennies a day of the over-the-counter high-dose niacin is established as an effective treatment for directly addressing atherosclerosis, hyperlipidemia, hypercholesterolemia, and coronary disease. Niacin has been used safely and effectively for over 60 years in clinical medicine. Generally, the higher the dose of niacin, the more effective it is. It's always best to take it with food and not in a fasted state. So in short, the growth of the penis relies on a healthy circulation, and niacin directly addresses these concerns in a safe fashion. The biochemistry of a male erection initiates from a cascade nerve signals starting in the brain and running the length of spinal cord down to the penis. In response to these signals, nerves sort of release nitric oxide gas molecules that drive production of a second messenger molecule in cells that ultimately applies the relaxing, expansive effect characteristic of an erection. However, a permanent erection is of course unacceptable. So nature has provided another enzyme, which is called PDE5, to break down the second messenger molecule. But pharmaceutical companies develop drugs like Viagra to inhibit PDE5, to keep the second messenger molecule levels elevated. As much as this is considered gold standard, it of course has major drawbacks and side effects. Niacin treatment increases nitric oxide, the production of nitric oxide, and causes a massive release of hormone-like compounds. Just like any other treatment, niacin requirements and dosing is highly individualized. Now, some individuals are more sensitive than others to the niacin flush response. First, one should always take high-dose niacin with food and not in a fasted state. Secondly, the more they take a high dose of niacin, the more they can tolerate it. So one may start their high dose at 100 milligrams 3 times a day and go for 1 to 2 weeks before increasing this to higher dose. Ideally, an individual can eventually comfortably take 500 milligram or up to 2,000 milligram per administration, taken once or twice a day. Some are very sensitive to even 50 milligrams, while others can take 2 grams and notice nothing. So generally not noticing anything though, it's not a good sign. So to prevent ED, it will likely be most effective to correct deficiencies with niacin and arginine, because the pathways depend on niacin and arginine for nitric oxide production. On the metaphysical side of things, of this issue, you may want to look into things like stress and anxiety, performance anxiety, low self-esteem, depression, relationship issues, past trauma, and guilt or shame. Hope this has been helpful. Like and follow for more. Be the light.